Hello friends, I'm Sandhya. Welcome to my channel Learn with Sandhya. In today's session, we will talk about SAS, clinical SAS introduction, what is SAS, and the concepts that are being used in SAS, how important SAS in the clinical domain. So, what is SAS? SAS is a SAS, Statistical Analysis System or software. So, as the name says, it mainly performs analysis by conducting mathematical calculations on the data in order to predict future and also to make decisions. So, basically, it is an analytical tool which is mainly used in analytics. So, in today's market, we'll see so many analytical tools that are available in the market like MS Excel, SAS, R, Python and so on. And SAS is widely used in different sectors and different industries like financial sectors, marketing sectors, clinical sectors. Now we'll just talk about how SAS is important in the clinical domain. So before that, I will just give a brief introduction regarding the clinical domain. So clinical domain is nothing but like pharma related, all the clinical trials, clinical research and management, clinical data management, everything will come under clinical domain. So it starts with the drug discovery. So whenever a new drug is discovered by a pharma company, which is called as a sponsor in clinical domain terminology, it has to go certain steps and certain processes in order to get approval from the regulatory authorities of different countries. Wherever the pharma company wants to introduce that particular drug into the market, it has to get those countries' regulatory authorities' approval. Like for example, if we take USA, the regulator authority is called as an FDA, India it is CDSCO, UK MHRA and so on. So each country has their own regulatory authorities which control the clinical trials and their research. So whenever a new drug is discovered, I said that it has to get the approval from the regulatory authorities. Like it is for India, it is CDSCO, that is Central Drug Standard Control Organizations, which is headed by DCGI, that is Drug Controller General Body. So not just the regulatory guidelines, but also it has to follow certain ICH GCP guidelines, ethical guidelines, and also follow the protocol, which contains the predefined plan that has to perform in order to conduct the clinical trials, all the procedures like SOPs and all that. So mainly the main purpose for all these guidelines is to ensure the safety and efficacy, of the human beings, like so safety, then their well-being and all that. So we'll see all the steps that are involved in a clinical trials, just in a simple way. Like first, a new drug is introduced, discovered. So for that, preclinical studies will be conducted after getting the approval from the regulatory authorities, whether it is safe enough to conduct clinical trials on the human beings. So once that has been passed, next step is clinical research, that is the trials which are conducted on the human beings. So in order to conduct these clinical trials, regulatory guidelines, ICH GCP guidelines and ethical guidelines has to be followed, and the pharma company has to make sure whether the clinical trials are in compliance with the GCP guidelines and all the regulatory guidelines and also protocol. So the sponsor will appoint the CRO, that is companies like clinical research organizations, and which has different departments for different tasks that has to be performed in a clinical trial. So first is clinical trial operations, that is CTO, and another department is CDM, that is clinical data management, and another one is SAS department. So whatever the data that has generated in the clinical trials, that has to be managed by the data management system, and after that analysis is performed and reports are generated using SAS procedures. So the CRO company will appoint a CRA, that is Clinical Research Associate, who monitors all the clinical trials operations in the respective countries. So the clinical trial organizations, they will conduct clinical trials in the countries in which they want to market that particular drug. Like for example, if they want to market the new drug to India, US, so they have to get approval from those respective countries' regulatory authorities also. So in each country, wherever they want to perform, they will be performing the clinical trials. So they need where do they conduct? They conduct the trials in hospitals, because this is a new drug which we don't know how it reacts when it is injected into the human subjects. So a well qualified physician, doctor, will be conducting the trials that is in hospital, and he will be called as a principal investigator. And the clinical trials is performed in different phases, like phase 1, phase 2, phase 3, phase 4, which has each phase has its own steps and the task that has to be performed. So once all the phases gets approval from the authority, then only the drug will be marketed. So in these hospitals, the trials will be conducted on the human beings. They are called as subjects, and they have to be voluntarily participate in the trial. Next, because the trials are conducted, there will be so many tests that will be performed on the human beings in order to understand how the drug is reacting in the human body, and whether it has any efficacy, how far it is curing the disease, whether it is how it is attacking the target sites, and are there any side effects, is it safe enough. So in order to understand all the details, tests will be performed. So a lot of data will be generated through the trials. So those data has to be captured from the site. So it will be captured through the ECRFs, that is electronic case report forms. So now the clinical data management will capture these data using EDC tools, that is electronic data capturing tools, and through the tools the data will be captured in the form of ECRFs, and it will be stored in the data management system. Now the EDC tools, they also has inbuilt edit checks. So while capturing the data itself, most of the data will be clean, and apart from the data that is coming from the source, that is site, there is some other data that will be coming through other sources also, because for certain tests that they have to perform, hospitals will be outsourcing to some other labs, vendor labs. So that data will not be captured by using EDC tools, so that has to be validated only offline. So here where the SAS programming comes into picture. So by using SAS, validation will be done through SAS programming. So once everything is data is cleaned, data validated and standardized, once the data has been standardized, next comes the SDTM mapping, that is Study Data Tabulation Model by CDISC. So this mainly, the main purpose is in order to get the standardized tabulation model with tables, because the regulatory bodies will accept only one standard format, that all the reports that are generated has to be in one format. So the SDTM tabulation model, they have their own set of predefined variables, and what variables they have to include, what variables, what data that has to be omitted, everything will be there. So according to that, the data sets has to be mapped into the SAS data sets, into the SDTM data sets. After that, next comes the report generation. So here also SAS, by using SAS itself, will be generating the reports in the form of tables, listings, figures, that is graphs. So SAS plays a very important role in clinical domain, like for complete analysis purpose, like from data entry, data capturing, data validation, offline validations, data standardization, data converting the standard data into STM data sets, and also for generating reports. So SAS plays very important role in all these tasks. So this is a brief introduction to the clinical about clinical domain. Now we'll talk about SAS. SAS. So it was, as I said earlier, it was mainly meant for analysis purpose. So to make analysis on the data that is generated by the agriculture. So it was first introduced by a US based company, that is SAS company, on Jan 1st, 1960, and it is also called as a SAS specification date. So this mainly they developed this software mainly to perform the analysis on the data that has been generated through agriculture. So analysis is nothing but doing calculations, right, which will be done only on the numeric numbers, that is numeric values. So defaultly the SAS will understand numeric data. So in order to make the SAS understand the other type of data, that is character, dates, formats, and all that, we need to specify specifically in the SAS environment. Later, after 1970, different concepts have been introduced into SAS, and from there onwards it is called as an integrated software. So let's see what are the different concepts that are introduced. The first concept is data entry. So SAS is being a software, it has its own environment. So we can enter the data directly into the SAS environment. So that is one of the concepts. And next is access. So in order to perform analysis on the data which has been generated from different locations and different places, different sources, we need to pull all the data right from the external environment into the SAS environment. So SAS has the concepts within it which helps to pull the data from the external environment to the SAS environment. Next, manage. So once the data is pulled into the environment of SAS, we need to transform the data, that is modifications to the data has to be done, and we have to do the cleaning, data validation, we have to standardize the data. So everything, all these concepts can perform with using SAS. Next, analysis. So it's a default one with SAS which is mainly meant for analysis, so analysis can perform using SAS. Next is presentation. So SAS is also used to make reports, that is for generating reports like in the form of tables, listings, and graphs. So in order to do all these things, we need to give certain specifications to the data so that SAS can understand other kind of data, that is metadata, which is nothing but data which defines about the data, like by giving a name, labeling the data, what data type it is, whether it is numeric, like character data type, mixed data type, formats for use for dates and all the year and all that. So certain specifications we need to specify, that is called as a metadata, which talks about the data. Now we will see, other than the concepts, SAS mainly can conduct three types of processes, like extraction process, transformation process, and loading process. Extraction, as we already discussed, SAS has the concepts within it in order to pull the data from the external environment. So it is nothing but an extraction process. So it will pull all the external files, like text files, XLS files, MDB files, CS files into the SAS environment, and it will convert those files into tables, that is SAS dataset files. Next is transformation. So it also involves in transformation process, that is managing the data, doing validation, standardization and analysis. Once everything is done, next the final step is loading process, that is presentation. It is nothing but visualizations. That is called as the loading process. Since SAS has all these concepts like extraction, transformation and loading, it is also called as an ETL tool. ETL tool. Now just we will see what exactly how the SAS perform the analysis. See, external files will be pulled into the SAS environment and SAS files will be generated. So SAS also has a database concept, so the files can be stored in the within the SAS environment also. Once all the SAS files are created, then they will be converted into standard formats. Okay, so everything will be converted into one standard format. So that is nothing but data warehousing, that is standardization the data. After that, analysis will be performed, and that is classified into two types, that is data aggregation and data mining. And once analysis is done, it is submitted to presentation, that is data visualization. If you see all these things, it has database concepts, data warehouse concepts, data aggregation concepts, data mining concepts, data visualization. So since it has all these concepts, it is called as an integrated software. Next, SAS modules. SAS has different types of modules like base SAS, SAS access, mainly to import and export the data, SAS reports to perform procedures like print report, which will be helpful for reporting purposes. SAS connect. It connects the external files to the SAS environment without extracting the data into the SAS environment. SAS ODS, that is output delivery system. You can convert the SAS files to the outside environment in the HTML format, PDF format and text files also. SAS stats, that is, it involves certain procedures like means, tabulate, frequency and all that. All the statistical procedures also it has. And one more is advanced SAS. It consists of SAS SQL and SAS macro. So SQL is nothing but structured query language, mainly works on a database. SAS macro, the main purpose is to reuse the codes, reusability of the codes. And there are some ready-made SAS tools also, that is interactive tools, like SAS BI, that is business intelligence, SAS DI, that is development intelligence, SAS EG, that is enterprise guide, SAS ER, that is report generation, SAS EM, that is enterprise mining. So these are all some ready-made tools that are available, that is which has drag and drop options, easily user-friendly tools. So this is all about little introduction on the clinical SAS, what is SAS, different concepts that are involved in clinical SAS, and why SAS is called as an ETL tool. So thank you for watching, friends. If you find the content useful and informative, please like, share and subscribe my channel. Thank you. Stay safe and healthy.